So frequently a patient will come in from a group home to have dental care done, and we can spend days, weeks getting consent, just permission to treat the individual. What's the story with that?
Yeah. So again, one of the things I've learned through experience is anything that can be done in advance of the appointment, in advance of the moment that that person walks into the practice to have their care done, is going to allow for more success at the actual appointment. So all of that paperwork, I see it all the time with my own child, whether we're going for a medical appointment or a dental appointment. And I seem to always be the one. I'm hoping it's trickling down because I'm getting questions about some of the other individuals that live in the home and them saying, hey, we know we do this for Tommy, so we're thinking like maybe we could do this for other people that live in the home. And it's things like, reach out to the doctor in advance. What needs to be signed, either the morning of the appointment or the night before? Get all that paperwork out of the way. Answer all the questions that are typically asked, when you're sitting there at the appointment, right? So that and talk about what the plan is for when they arrive. Oh, we're going to do weight first. We're going to do x-rays. We're going to do this, because then the home and the individual supporting that person can show some pictures and kind of give them a heads up about what's about to happen, just setting yourself up for success. The staff so appreciate that because it's less of a burden on them. It's a quick in and out of the doctor's appointment. You think about the amount of time and energy and the distance sometimes that has to be traveled just to get that individual there, and to then get nothing done because we didn't have the right paperwork.
So we have people who travel to our site for 2.5 hours because we're the closest dentist that they could find that said yes. Getting the transportation is difficult. The person who does the transportation may not actually be the daily caregiver.
That's right.
So teaching how to do toothbrushing is not as easy as we use. One of the things that came out of COVID is we learned how to use teledentistry. We try to collect our health histories beforehand. We try to talk about what the consents are. The medical histories sometimes can be so complex. We need consults. We need this. We try to do that before they get here. Because remember, even a 30-minute ride, you talked about changing the child, getting the child ready to transport, cleaning their teeth, feeding them, bringing them to the dentist. That's hours of preparation. You don't want to get there and have the person turn around and walk out. No, I need this information or I need this consent. So trying to get that done before, and both the group homes, the parents, the caregivers all need to be aware that we can do better. And we do try to train our dental students so that they become a little bit more informed about this.
Can we talk about after the appointment?
Sure.
So you're giving all these oral hygiene instructions, to your point, to the person who drove that person there, right? And so how does that get communicated back? And how does the importance of it get communicated back when that individual leaves? Because we've said over and over, prevention, 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 right? Of course, being the hygienist, that's like where my goal and my focus always is. And another thing that I learned through experience is that when that individual leaves, especially if they're in a group home, there are two forms of care. One is considered medicinal and is the responsibility of the nursing and medical staff that support those group homes. And the other is considered daily living activities. And unfortunately, toothbrushing goes on the list of daily living activities. And so there's very little to no accountability. Like hairbrushing goes on that list, washing somebody's face or body goes on that list. And if somebody's having a tough day and you can't get around to it, nobody's checking to make sure it's been done. But if it goes on the medical list, and one of the ways I've learned that it can get on there is if the dentist or doctor writes that there is a wound in the person's mouth, that's nursing. You've got bleeding tissue, that's a wound. And that you're providing a medication and a medical device to treat that wound every day. The medication is toothpaste with stannous fluoride, and the device to apply it is the toothbrush.
Or a more concentrated, a prescription
In
toothpaste.
prescription
I mean,
yes.
there are ways that can be done
Yes.
that are quite legitimate and important for us to think about.
Yes.
So that'll even go a step further. We know that in order to get tooth decay, you have to eat sugars.
The diets.
So approaching diet through medical orders, if I am finding tooth decay in an adult's mouth, in a child's mouth, in a patient that has Alzheimer's disease, I know they are getting sugar somewhere. So if we're brushing well, if we're applying fluoride, we can control and not get a mouthful of decay. If we're seeing plaque and redness and bleeding gums and things are not going well, I have spoken to the dietitians or written orders for nursing to treat this person as if they were a diabetic and take the sugar away. Because we can control this disease. And is it better to go to an operating room every 2 years to take care of a mouthful of decay? Or are we better off giving an artificially sweetened cookie and taking away the availability of sugar, sugar-sweetened drinks, sugar cookies, reward system is very... If we don't do these things, we wind up in this cycle of needing the repair and needing more. The home care issue, we actually will do teledentistry with today everybody's cell phone and FaceTime and all of that. We will do Zoom calls to talk about, well, if you stand behind or if you come alongside, if you put your hand over their hand, if we just get it between their lips initially, we prescribe a lot of fluoride to be utilized in prevention. I think we need to think differently as practitioners, as hygienists, as dentists about how to prevent this disease and try and share that aggressive behavior in preventing it with the group home. And then reshare it because, as we said, the staff changes, everything. We need to review this. It becomes something that needs all sorts of real actions moving forward.
We've even taken it one step further, and he has a diet with what time of day, and this is the only time of day that he is allowed, and this is the list of things that he is allowed, because grazing, and to your point, reward systems, constantly putting food in the mouth does not allow that pH to become neutral in that saliva. And in addition to that, he's got a prescription for xylitol gum, and it's 2 cubes a day, and they cut each cube in half, and he gets one of those 4 pieces throughout the day. And so there's so many little things. And to your point, I actually, because I'm a hygienist, I get a video every day of them flossing his teeth, and I'm able to watch what's happening with that video and support certain individuals who are trying to care for him, where some people are doing a good job. Why should I,
don't disturb what's working.
Exactly. Yeah. So lots of little things that can amount to someone's incredible oral health.
But it is achievable if we keep trying.
You're right.